The government are set to announce mandatory COVID jabs for care home staff. It's under new plans being drawn up by ministers as they consider extending that move to all NHS staff.
David Crabtree owns 2 care homes in North Yorkshire, says there's no way he will continue to employ someone who refuses to get jabbed. But Adam Purnell manages Kepplegate House Care Home in Lancashire and says recruiting people to work in care homes will now be much harder. Dr. Amir Khan joins us as well from Leeds. Good morning to you. Adam Purnell, what is your concern about staff?
So, for me, I think the concern's always been there needs to be more of a focus on educating, supporting and helping people realise the importance of the vaccine. I'll preface this by saying I'm pro-vaccine. Everyone working in social care or health should have the vaccine. But people do have a choice, and we need to be working more with providers who are failing or are struggling to get their workforces to have a good percentage uptake of the vaccine. I think
it's about persuasion, Adam, but if this comes in, if you can't persuade the government simply to persuade, and there is a mandatory jab or you face losing your job, how many staff do you think you might lose?
I probably won't lose any. I'm very lucky. We've had a really good uptake of the vaccine, so I probably won't lose any staff. But
so there's no one who's refused currently in your employment?
I've got one who's still contemplating. She's not refused, still contemplating, and I'm happy with that because we have regular conversations. And as soon as the vaccine became available, the first thing I said to my team was, your jobs aren't going to be compromised. You've worked tremendous throughout all of this. We've remained COVID-free, so we need to work at risk mitigation and education before we start enforcing it. If in 16 weeks we're being told that we've got to lose staff, where's the road? Safeguard the sector.
What's the problem with this one person who you say is still considering it? What's her issue with it? Is it cultural? Is it religious? Is it superstitious? What's going on?
I mean, at the end of the day, it's personal reasons, Richard, so I don't really want to discuss her case live on TV. All I know is, or all I want to say is I respect her decisions and her reasons behind it, and I'm helping support her with it.
But more broadly, Adam, you say that you're pretty much successful with your employees. More broadly across the sector, what's your biggest concern about how many staff may go?
My biggest concern is if we're talking about care homes that have a 60% uptake of the vaccine, in 16 weeks, those care homes could be down 40% of their staff, which the vaccine, the virus is dangerous, is life-threatening, it's horrendous, it's horrific. No one's devaluing that. Okay. But having a care home operating with 40% less staff than they need is also a crisis. It's also a safety issue.
Well, let's go across to David Crabtree. You've been on the show earlier today on our news bulletins, David, and you're absolutely emphatic about this. No jab, no job. And in fact, you've said we should have brought this in a long time ago.
Without doubt. What we've now got is we're very fortunate that all of our staff have elected to have the vaccine, and I think that every person electing to work in care has a personal responsibility to take on what is it that will protect residents and colleagues. It's not just the residents. I think where the biggest danger lies is where you've got agency staff going into care homes, and I think that's the biggest transmission point, that they should be mandatory told to have a vaccine before you can work in a care home. Now, where we've got a stagnant permanent workforce who have agreed to it, that's fine. I need to be able to ask an interview, are you willing to have a vaccine? And if not, I should be allowed to say, I'm sorry, I can't offer you that post. And now I have some legal protection that will allow me to do that.
And what possible reasons would people give to you for not having a vaccine? Obviously, we accept there are some people that for medical reasons aren't suitable for vaccines. We get that. But what about all the other reasons that people put forward? They don't trust it. It's been developed too quickly and maybe it won't work properly. They're too healthy. I've heard actually people say this at the shops. Oh, I'm really healthy. I don't need a vaccine. How do you counter those kinds of arguments?
It's very simple. If you believe that, and I support totally their rights to those beliefs, don't apply for a job in care.
Well, but
it's very simple.
We
have to reassure the public that care homes...
Sorry, David, I was just going to say, because we'll talk to Dr. Khan in just a moment about what the medical reassurance might be for those people in those situations. But if 85%, around 85% of care home staff or care workers are currently vaccinated, that looks like a 15% sort of resistance rate. That's a huge number of care workers we might lose. Are you not worried about that?
We are desperately worried. I mean, the sector as a whole is understaffed, and we've now proven difficult to get people in from other countries. But the reality is we have a mandate to protect our residents, and to do that we have to use every tool in the box. One of these is one of these. As your previous interview said, to get a vaccine that normally takes 15 years in 1 year, why would we not use it?
Susanna sketched out a really interesting scenario on this about an hour ago, when she said that what if you have a situation where you have a fantastic care worker, someone who's gifted in the field, who's got a very important one-to-one relationship with somebody in the care home on which that person is very, very dependent, physically and emotionally, but that person won't take the jab. Surely you'd feel really uncomfortable letting that person go.
Oh, without doubt. I don't want anybody to have to leave care. Particularly, I mean, I can do nothing but applaud the dedicated social care teams, not just the carers, but the cleaners and the maintenance and the cooks and the laundry people. They have done wonderful, wonderful work over 18 months. And fortunately for me, that they've all agreed to have the vaccine. But I have to protect these other care staff. I'm over the moon that this is coming.
OK. Dr. Khan, what are your top 2 persuasion techniques for those who won't take it?
Well, it depends on the reason. So I always go down the safety route and make them understand that even though this vaccine may well have been developed in a year, it's gone through very rigorous safety checks. And if anyone has any specific concerns, and we're talking about younger people, they may have issues, they may be concerned around fertility. There's no evidence that the vaccines affect fertility in any way. So it really does depend on what their concerns are. And I will sit down and take the time to talk to them, because I think it's worth it. If we can persuade them to have the vaccine, it is worth taking the time to do that.
Dr. Khan, thanks very much indeed. And to our other guests, we appreciate your time.